Welcome back to Our Chicago. I'm Tanya Babich. My guests this morning are Celena Roldan, the Regional Chief Executive Officer of the American Red Cross of Illinois, and Dr. Kyle Mack, a pediatric hematologist with Lurie Children's Hospital. Celena, I want to talk to you about the role that the Red Cross has played in helping to better understand the course of the pandemic, when it might have actually started, when it landed in the United States. We actually discovered that it arrived here earlier than we initially thought because of donations from the Red Cross and some testing that was done after those donations were given.
So the Red Cross, again, has been proud to play a critical role in providing critical public health information to any of the entities across our country, our public health departments, our government, and others, to make sure that we are trying to do everything we can. We've always played a role historically to do everything we can to keep individuals and communities safe and resilient. And so just as we're doing, just in the similar regard, how we've been doing antibody testing for all of the donations that are currently coming in from people that are donating blood as a way of providing an additional metric of public health information to individuals as well as to communities, and we're committed to continuing to do that.
What might you do with blood that tests positive for antibodies? In order to use that blood for any kind of therapeutic purpose, must the donor have been diagnosed with COVID?
So one of the most important things that we are doing at this time is also producing convalescent plasma and providing that as a potential treatment to those that are currently fighting COVID-19. So we are testing all whole blood, platelet, and plasma donations that come in for the antibodies for COVID. And so in that sense, if they are tested, if they do test positive, that can be used to be produced as a convalescent plasma treatment for those that are fighting COVID-19.
Dr. Mack, the idea of giving the gift of life is certainly a beautiful one. It is also an abstract one for the vast majority of the population. They want to do something good. They want to roll up their sleeve. They want to donate blood. But you actually get to see the patients who benefit from these donations. Can you help our audience to better understand what that gift of life actually looks like, what it means?
Yeah, so this is an important question. I think, our patients are tremendously thankful when they're able to get blood. Think of the parent who's bringing their kid in who has cancer and is first diagnosed and is in the emergency room, and they've just been told that their child has cancer and their hemoglobin's low and they're going to need a blood transfusion. Or someone who, God forbid, gets into an accident and needs emergent surgery and needs a blood transfusion, or an adult with leukemia who has complications from chemotherapy who needs a blood transfusion. All of these scenarios happen constantly. So there's a constant need for blood. And it turns out that during the winter months, understandably, when it's cold, there's inclement weather, people are historically vacating, maybe not now vacating as much. The donations tend to go down. And so there's a tremendous need during the winter time, especially to encourage donors to donate blood. I've donated blood myself during the pandemic. It's remarkably safe. I've worn my mask. I've had my temperature checked. Staff are incredibly careful in maintaining my safety and their safety. The spaces are separate. There's plenty of space between donors. And so it's really helpful for patients. I think patients ultimately are incredibly appreciative of someone giving of themselves.
Celena, very quickly, let's run down the list of qualifications in order to donate blood and where people can find more information on how to give.
Yes. So at the basic requirement, if you are over the age of 17, in some states it's 16 with parental consent, over 110 pounds, and you're healthy, you can donate blood. And so people can go to redcross.org/blood to find out more information. And obviously, we're incredibly excited and so grateful to ABC7 for supporting us for the 7th annual Great Chicago Red Cross Blood drive that will be coming up on January 13th, where people can still make appointments. Appointments strongly encouraged. We're going to be in 5 locations in Chicago, Lake Zurich, Orland Park, Schaumburg, and in Munster, Indiana, where people can come out and roll up a sleeve and help save a life.
Well, I've been donating since I was a teenager. It's easy to do, and I've got the Red Cross app downloaded on my phone. Thank you both for your time today. We appreciate it, and thank you for all you do.
Thank you, Tanya, so much.
That does it for our Chicago. Thank you for joining us. If you want to donate during the ABC7 Great Chicago Blood Drive, it is coming up January 13th. It runs from 7 a.m. through 7 p.m., and there are 5 locations, and the Red Cross will have safety protocols in place, of course. To make an appointment, call 1-800-RED-CROSS or visit our website or news app.